coming from different parts of the world to be with us today. The wonders of technology now, right? Welcome to this Avita Philippines sponsored talk on the future of preventive health. A very timely topic in this fast aging and changing world. Well, I am Attorney Johnny Gutierrez, a Platinum Director of Avita and your host for today. I am a very firm believer of the saying, prevention is better than cure. Having been diagnosed of colon cancer stage 2 in May 2019 and losing my mom and my husband to cancer too, I personally know how costly, painful, and burdensome to suffer from a chronic disease or a neurodegenerative disease. Lahat po apektado sa pamilya, kaya mahirap magkasakit, hindi po ba? That is why we have to take good care of ourselves, right? Did you know that chronic diseases like cancer, diabetes, heart ailments, autoimmune diseases, and neurological disorders such as dementia, Alzheimer's, Parkinson's are the leading causes of disability and death all over the world? Totoo po yun. And today, we are also faced with a virus called COVID-19. And now, its new variant, the so-called Delta, which is more fatal and can spread like fire. That is why here in the National Capital Region and some parts of the Philippines will be undergoing under the enhanced community quarantine. Wow. Okay. Before I introduce our distinguished speaker, of course, we have to get to know each other, engage each other, right? So I would like to ask some questions, and please type in the chat box for your answers. Be candid, okay? How many of you are having some health issues or concerns right now? Please do type in the chat box. Okay, for those who have said yes, I can really empathize with you. I know how worrisome it is to be thinking of your illness and your family as well. It can give you sleepless nights, right? Okay, here's another question. How many of you have loved ones who are suffering from degenerative diseases like cancer, diabetes, arthritis, osteoporosis, dementia, Parkinson's disease, or have children who has autism, depression, and the like? Please type 1 if it is a yes in the chat box. Okay. So all of us here have loved ones who are suffering from chronic degenerative diseases. And this is very alarming, right? Well, this is the very reason why we at the Vita Philippines are so intense in promoting preventive health awareness and conducting series of health talks in order to help each and every one of us understand the causes of these diseases and how we can better equip ourselves in protecting our health and our loved ones. This morning, we are so privileged to have with us one of the most prominent doctors in the field of sports and regenerative medicine in the Philippines. He is actually an orthopedic surgeon and is the president of the Philippine Orthopedic Society for Sports Medicine. He holds master's degrees in molecular and cell biology from the University of the Philippines and epidemiology from the Ben Taub Research Center, Baylon College in Houston, Texas. He was among the first few medical professionals in the Philippines to understand how oral marine cell therapy works in the prevention of degenerative diseases. And now, he has decided to focus more on private practice on regenerative medicine research for both hospital and clinical setting. Ladies and gentlemen, let's all hear from the expert, Dr. Benedict Francis Valdecanas.
Hello, good morning, everyone. Let me start my slide so we can get this show on the road. Okay, so this morning we will be discussing the future of preventive medicine. If there's a cure for aging, then it must be at the cellular level. So clinically, aging is a general process or a decrease in body functions wherein your hormones decline, enzymes and other biochemical substances steadily drop, substances produced by our cells and their respective levels and balance being chemical messages that tells nature, hey, this is an old body. You can start to break it down. So what do we do in our attempt to cheat nature and prolong aging? We try to prevent illness by trying to detect diseases early through the regular executive checkups that we usually do on an annual or even more often basis. We have blood chemistries like this one. We do our stress tests for cardiovascular health. And we even have imaging modalities that help us detect cancers very early. If we are to consider aging as a disease, then delaying aging may be its cure, and keeping our cells healthy enough is that cure. Thousands of years ago, Hippocrates said that the body heals itself from everyday wear and tear. It is then a race between degeneration and regeneration.
Excuse me, Dr. Ben, are you sharing slides?
Oh, sorry. You're not seeing the slides?
We cannot see any slides, po.
Oh, sorry.
Thank you.
Can you now see the slides?
Yes, we can. Thank you.
Okay, sorry about that. Let me start over. Okay. Okay, so as we were discussing the future of preventive medicine, if there is a cure for aging, it is actually on the cellular level. So clinically, aging is defined as a general decrease in body functions. These are actually when your hormones decline, enzymes and other biochemical substances steadily drop. These substances produced by our cells in their respective levels and balance are chemical messages that tells nature that this is an old body and you can start breaking it down. So what do we do in our attempt to cheat nature and prolong aging? We try to prevent it or prevent illness by trying to detect diseases early through the regular checkups that we usually do on an annual basis or even more often. Aside from blood chemistries, we do our stress tests to ensure that our cardiovascular functioning is of optimized level. And we even have imaging modalities that try to detect early cancers, like this one, cancer of the breast is early detected by mammography or digital mammography. So if we are to consider aging as a disease, then delaying aging may be its cure, and keeping our cells healthy enough is that cure. Thousands of years ago, Hippocrates said that the body heals itself from everyday wear and tear. So thus, it is a race between regeneration and degeneration. As you can see here, our bodies upon conception are made up of cells that contain genetic material. That is the blueprint of each and every cellular existence. And as you can see, the DNA is the basis of that existence. The DNA is the genetic material that actually unravels to reproduce cells during our development and repair. But how were we made? It is actually by cellular division as well that all the cells that make up the tissue, that make up our organs, that make up our different bodily systems, that make up our whole body. This is the basis of reproduction, not only in the organism level, but more importantly at the cellular level. Hence the topic of cellular regeneration. Because why do we even have to divide our cells when we're already fully developed and grown up? Because cellular division is also the basic process for this, repair and regeneration. The genetic material inside each cell dictates the cellular division that is how dividing cells are exact replicas of each other. The normal function of the human body is thus maintained. So what if the cell has been so damaged that its genetic material cannot dictate cell replication anymore, and this cell dies unable to bear offspring, so to speak, to replace itself in that tissue or organ? This accumulation of senescent cells, unable to repair themselves by replication, is actually the basis of aging. So this brings us to the topic of telomeres. Telomeres are practically caps or codes that are found in the end of our genetic material. Every time a cell divides, it has to replace or replicate its genetic material. And every time the DNA unravels itself to replicate, it loses a part of its telomere. So every time a cell divides, the telomere becomes shorter and shorter. Once the telomeres are consumed, the genetic material cannot replicate itself anymore, and the cell ceases to divide and reproduce itself. It then enters its senescent age or senescent stage. So, as said, this is a series of nucleotides that are the limit to a cell's capacity to replicate or divide. So each replication shortens the telomere, as you can see. Genomics is the study of an organism's genes and the manner by which this genetic material is replicated. And each replication has a risk of exposing a mutated gene or code. And this is the basis of disease. So basically, genomics is the evaluation of a person's risk for lifestyle diseases for the purpose of prevention, sort of being able to predict disease. Thus, predictive medicine is the future of preventive medicine. Without disease, our bodies are designed to reach 150 years. And this is the concept that was the basis for this Time magazine cover a few years ago. Disease is the result of the interplay between what is encoded in your DNA and how you live your life, what you eat, how you move or don't, and to your toxins, what kind of toxins you expose yourselves to in the environment. And we all have to remember that part of the environment that we put in our bodies is food. And food can be a toxin to one's body, believe it or not. Therefore, to cure aging is to prevent our bodies from getting sick or ill, and knowing what diseases we can get in our lifetime through our genomic testing is a step forward towards curing aging. So how do we cure aging? There is no silver bullet. It still is through a healthy lifestyle, through a well-balanced diet, regular exercise, or constant movement, for our bodies were designed to keep moving. And last but not definitely the least, proper supplementation. There are all sorts of supplements out there, and it is very difficult to sort through these plethora of supplements to choose the right one for how our body functions. These are the foundations of health and wellness, wellness being defined as the absence of disease. And since diseases happen when our cells are too damaged to repair themselves, we have to make sure that it gets all it needs, and each cell must be able to repair itself before irreversible damage occurs. But there is a new disease of pandemic proportion that challenges our longevity. And this attacks the very core of our immune cells, their DNA. You've heard how a virus enters our cells and commandeers our genetic material, genetic machinery to replicate itself and render the cell useless and eventually dead, thus rendering them incapable of replicating itself to repair tissue, but only to replicate this virus and spread it around. The good news is our body fights back. It recognizes this invader and creates defense through its intact DNA by producing more and more immune cells to battle this. And this raging, ongoing battle, as we have seen, pushes certain age groups to succumb more than the others. This data from the Chinese CDC shows the elderly or aged population are more the ones who get overwhelmed by the viral invader and succumb to it more. That is because senescent immune cells cannot replicate to build that army need to battle the viral infection. This is termed immunosenescence. It is basically the gradual deterioration of the immune system brought on by natural age advancement, and it affects the adaptive immune system more than the innate immune system. The adaptive immune system being that part of your defense that needs to replicate cells and not virus. It involves both the host's capacity to respond to infections and the development of long-term immune memory. If you have senescent cells in your immune system, then there is no memory to fight the virus. As with all viral pathogens, SARS-CoV-2 mutates, and the recent development of the Indian COVID, or the Delta variant, has made it less deadly but more contagious. Their findings suggest that people who have contracted the Delta variant are likely spreading the virus earlier in the course of the infection. Getting fully vaccinated is the long-term solution to this perpetually mutating invader. Preliminary data shows that in some US states, up to 99.5% of COVID-19 deaths in the past few months were among people who weren't vaccinated. This from the CDC Director, Dr. Rochelle Walensky. She said 97% of those currently hospitalized with COVID-19 disease are unvaccinated. She states, "We know that the Delta variant is currently surging in pockets of the country with low vaccination rates. We also know that our authorized vaccines prevent severe disease, hospitalization, and eventual death from the Delta variant. So even though the variant is more transmissible, initial hospital death data shows that it doesn't increase the risk of hospitalization compared to other strains among those who are fully vaccinated." As our body's defenses improve with vaccination, we still have to provide what it needs to fight back: sufficient sleep, adequate hydration, good food and proper supplementation, as seen in this slide. We need to ensure that our body can repair its own DNA. Prevention of damage or mutation to it is tantamount to prevention of disease, which leads to proper functioning of the cells that comprise the human body. And this because not everything your body needs to repair itself is in the food you eat. Thus comes the era of cellular supplementation. And this acts at the cellular level where disease strikes its most deadly blow. It is natural, it is biocompatible, being made up of genetic material or actually nucleotides, and potent and safe. So as stated, the components of cellular gen is bio-DNA cellular marine matrix, derived from deep sea fish, peptide E collagen, hydromononuclear peptides, lutein, grapeseed extract, CoQ10, and selenium, all the necessary ingredients for the maintenance of a healthy DNA. So let's tackle each and every component one by one. Hydromononuclear peptide is proven to reduce the dietary glycemic index. It aids in maintaining a healthy body weight and reducing the risk of obesity, while alleviating symptoms of type 2 diabetes. This clinical study shows the effect of peptide N on blood glucose levels after meals. One of Celergen's ingredients, it is a marine protein hydrolysate proven to reduce the dietary glycemic index, or GI. It is shown to prevent unhealthy body fat accumulation, which aids in maintaining, as mentioned, body weight and lowering the risk of obesity and diabetes too. We all know that glucose that enters the blood from food is used for energy production, but excess glucose is transformed into fat and stored for later use. Over time, this constant storage of fat leads to obesity. In the graph, the second frequent sharp prolonged peaks of blood glucose and insulin, and this leads to insulin resistance. This is usually seen in high glycemic index foods. That's why the effect of hydro-MN peptide is most valued at this point. So this figure also shows the results of a study evaluating the effects of different proteins, peptide N, fish fillet, fish fillet, casein milk protein, and soy protein isolate. These are known to lower the body's response to high glycemic index foods. And this was done on 17 volunteers aged 32 to 64, perfect age for developing diabetes mellitus 2. Now, peptide E collagen, as shown in this study, decreasing inflammatory swelling of joints with consistent intake, is an anti-arthritic known to be against progressive destruction of joint cartilage. It helps prevent damage to the synovial membrane or the joint membrane or the joint sac due to chronic inflammatory process, thus breaking the vicious cycle of osteoarthritis. For osteoporosis, it is also helpful against the progressive deterioration of the protein network or framework in bone. As we know, bone buildup from collagen provides the basic skeletal framework. This is also given or highly recommended with calcium, calcitonin, and vitamin D3s. It also has a very good effect on the skin. As shown in this study, it reinforces skin hydration in a clinical study of 44 subjects over 40 years of age, when you expect your collagen to be sagging due to dehydration. This study showed or resulted in a finding that there's a 10% increase in hydration for consistent use over 3 months. It also has an anti-wrinkle effect by maintaining collagen integrity, providing firm and lifting of mature skin tissue. It stimulates the biosynthesis of dermal collagen for the lift and toning that is most observed in people who are consistently taking Celergen, thus minimizing the lines and wrinkles as said on this clinical study. Let's go to the bio-DNA cellular marine matrix. More importantly, this content positively impacts maintenance of tissues and organs at the cellular level, as seen in this study where pain improvement is seen significantly in knee osteoarthritic patients. This substance provides the nuclear ingredient in maintaining or repairing your DNA or genetic material. This study shows improvement in back pain symptoms and other symptoms associated with a multitude of wear and tear diseases. It also impacts on maintenance of mental faculties, as seen on this graph from the same study. From another study, it is found that the recovery time is much shortened after a physical workout, and this is the most effective improvement that I've seen in my athletes who I've given this product. If I were asked which of these slides or findings is my favorite, this would be it. This study shows, and it is a landmark study, the cellular effect of Celergen on cancer cells, particularly liver cancer cells. So this first graph shows that Celergen significantly inhibits the proliferation of HepG2 human liver cancer cells. This growth inhibitory effect of Celergen on HepG2 where cells were cultured for 72 hours with or without Celogen at concentrations ranging from 25 to 200 micromoles. And as seen here on day 3, the number of viable cells has significantly decreased. This graph from the same study shows the effect of Celogen on cell cycle and apoptosis, or senescence and cell death. This is also seen in HepG2 cells that were treated at different doses, at ID 50 and ID 75 for 72 hours again, and properly stained to assess DNA content. The percentage of cells in each phase of the cell cycle was assessed by flow cytometric analysis, and the data showed that the vertical line indicating the percentage of apoptotic cells, the white bars, the dotted bars, and the black bars show this decrease in apoptosis. Graph 3 shows the effect of Celogen on what we call the P21CYP1 protein. It also shows the GADD153 and the c-MYC mRNA expression. This is the genetic expression of the cancer cells. So real-time quantitative RT-PCR, so as you can see, RT-PCR was used even way before this pandemic. And this was performed over the total RNA from the HepG2 cells, treated with 50 micromole Celogen or none as the placebo. And these test periods were indicated on the bottom, ending at 72 hours again. This next graph is for the GADD153 gene expression. And this last graph is for the c-MYC mRNA expression. So there's a significant decrease in the cancer cell expression or cancer gene expression. This is quite an important finding because there are quite a number of cancer cells that are c-MYC oncogene driven. So this includes your lungs, lung cancer, colorectal cancer, stomach cancer, breast and cervix, uterine neuroblastomas, and Burkitt's lymphomas, or cancer of the lymph nodes. So if Celogen helps your DNA repair itself from all these mutations, including some oncogenes or cancer-producing genes, there is yet another substance that can help ensure our bodies, particularly our nervous system, functions normally or optimally to repair nerve cells, fight neurodegenerative diseases then, and extend our longevity with a very clear mind. What's the use of living long when you cannot sensibly enjoy life? The nervous system of the human body is composed of 100 billion or so neurons. So what's the problem if some of them die? This is the problem. Chunks of your brain function are taken away. So part of this central nervous system is our autonomic nervous system. And as the name implies, it is a command and control and communication center of all the systems and functions in the human body, including stress and commanding immune cells to fight against viral invasion. This needs a very intact nerve system or nervous system. That is why we can now even assess the functions of a person's autonomic nervous system. This allows us to peek into the improvement or deterioration with any intervention, such as neural regenerative supplementation. The most promising substance so far yet studied is the NGF. And as you can see, this has been true for decades now, as shown by this study done 3 decades ago. So what is NGF? It is actually a neural growth factor found in birds' nests. So it stimulates the production of nerve growth factors. It regulates and enhances the immune system because the brain or the nervous system, particularly the autonomic nervous system, is what drives our immune defenses, especially important in this pandemic we are now in. It enhances memory retention and prevents neurodegenerative diseases such as dementia, Alzheimer's, and Parkinson's disease. This is much more applicable for chronic diseases and all viral infections. NGF as a product also contains a lot of other substances which help the nerve regenerate or the nerve cells regenerate. This includes purple chokeberry at 25 milligrams. This is known to improve one's natural production of insulin. So it helps not only in preventing diabetes mellitus 2, but increases insulin sensitivity of your body. It is also known to be an anti-inflammatory, and it is a natural cancer fighter or an antioxidant. Bacopa is also found in NGF. It also is known for memory improvement. It protects the brain against aging and dementia then. It is also an anti-anxiety and antidepressant, being able to facilitate natural production of tryptophan, which is the basic amino acid for your serotonin or happy hormone. It is also known to be a blood pressure regulator by relaxing the blood vessels even in times of stress. Sage extract is also found in NGF, and it is known to boost cognitive development and improvement of the immune defense system. It also is known to lower blood glucose and cholesterol, and it's beneficial in improving digestion. Nattokinase is also present. It prevents heart attack and stroke by directly involving or impacting tone of the blood vessels and taking away the toxins lining the endothelial walls of these blood vessels, thus being useful for reducing blood clots. It generally improves blood circulation then. Lastly, NGF also contains beta-glucan, or 25 milligrams, known to strengthen the immune system. It's the basic protein or ingredient that helps bodies build antibodies or proteins. It protects against diabetes-related complications by maintaining the tone again of blood vessels and improves circulation, and thus lowering the risk of obesity. So if this is all contained in your bird's nest, why not just eat the edible bird nest soup? It's a common question that is asked of me whenever I give this presentation. Well, one, hygiene concerns. Premium bird nest extract in NGF is derived from biotech extraction of bird nest premium essence, a processing method that is used not in the kitchen but in the laboratory. There is a strict selection of the most effective ingredients, like I mentioned, which actually help vitalize or improve the autonomic nervous system. So this study is a landmark study done by Professor Lim Ka Beng of Singapore's A-Star Labs. This was monumental in developing this product, and fortunately, this is also what got this product to be accepted in the medical circles. So this is a table of neural progenitor cell growth with natural NGF and with supplemented NGF, as you can see in the dark green or deep green bar. And in a matter of 7 days, there is a very significant improvement. Since we know that nerve cells are the most difficult cells in the body to regenerate, 3 decades ago, we did not even know they regenerated. The neural growth factor in NGF speeds up and facilitates the regeneration of nerve cells. And with cellular gen, the integrity of genetic material or DNA of these nerve cells are also maintained through nucleotide repair. In 35 years, we will see the most number of centenarians in our lifetime, with these numbers increasing tenfold, provided, of course, that we will live long enough to see them. So let me leave you with this parting advice during this time of the COVID-19 pandemic, since most of the people who succumb to it are the aged. So let's boost our immune system, particularly our aging immune system, through proper diet, adequate rest or sleep, where the time where our body regenerates and repairs itself, regular exercise, and a way to relieve our body of this stress and toxins that plague it on a daily basis. Let me also leave you with this quotation from the man that we noted earlier on this talk, Hippocrates. And thank you. Maybe we can open the floor now for Q&A.
Doc, we will go into that later on. Okay, thank you very much, Dr. Ben, for that very informative and enlightening lecture, especially for sharing to us how Celergen and the natural growth factor, two of the premium supplements of Avita, can help us protect, prevent, or prolong the onset of degenerative diseases. You really never cease to amaze us with your wit and charm.
Thank
I
you.
wish, yeah, I wish more doctors will be like you, taking a proactive role in the prevention of diseases rather than focusing on reactive treatment. There you have it, our dear guests. Health is truly wealth. And we learned today that aging is a disease, okay? And that our body can heal itself from the everyday wear and tear. We can cure our body by having a balanced diet, regular exercise, and proper supplementation like Celergen and NGF that has all the ingredients to help our cells repair, regenerate, and maintain its cellular health, which is critical to our body tissues and organs in optimum health. Now, before we go to our question and answer portion, I would like to invite some sharers of how Celergen and NGF help them. Take note that their sharing is their own personal experience, and please do not share it on social media. Okay, let me call on Miss Rose Dumpit. Rose has just recently retired from her work. Mind you, she had 40 years of works experience in healthcare industry and worked for big multinational pharmaceutical industries and have been very instrumental in launching of blockbuster products like Citromax, Cefimac, Unicin, to name a few. Now, she has turned to natural remedies to protect and take care of her own health and that of her family now that she is also aging. Hello, Ate Rose. Okay,
Excuse me, please.
over there. Ate Rose, can you please unmute?
Ah, there you are. Sorry.
Yeah, sure.
Okay. Thank you, Attorney Jonna, for inviting me to share my story. Good morning, everyone. Yes, I'm Rose Dumpit, and I have recently retired after 40 years of experience from the pharma healthcare industry. And also, as mentioned, I have launched several innovative and blockbuster products to include two major infection control products from Switzerland. I handled responsibilities for antimicrobials, pain, cardio, but I was never really into wellness and nutraceuticals. However, in 2016, Attorney Jonna introduced me to Celergen, and we both attended symposium in Alphalan, where the speaker was no other than Dr. Ben Valdecanas himself. Hi, Doctor. I was amazed by the presentation and the product that led me to purchase 2 boxes of Celergen right away. I was thinking of improving my health and total well-being because I have lots of them: cardiovascular, metabolic, gastrointestinal, neurodegenerative problems. That time, I didn't really feel that effects because I was so much preoccupied with my work. Attorney Jonna never ceased to invite and send me testimonials as to what Celergen can do to the body. Last year, COVID-19 pandemic struck the country and the whole world. And I went through a lot of anxieties and even depression for fear of me and my family getting infected with the deadly virus. I was abreast about it since I was handling infection control business then. And every day I got news about COVID-19 cases, including deaths of some of close friends who were doctors, and with a lot of uncertainty. I was also pressured at work that I got short-tempered and always nervous. And then I was also paranoid, and I kept calling my doctors the minute I felt something similar to the symptoms of COVID-19. Then I recalled Celergen and I immediately called up Attorney Jonah, and I rushed my order. I took it and I really felt something good inside me. You know, I felt I have a powerful security and immunity booster behind me. Then I started sharing Celergen and NGF to my brother, who was also diabetic and has a lot of health issues. And he claimed he felt so good after taking it, especially improving his sleep patterns and a total well-being. My sister from the province, who was hospitalized twice last year and was very weak, suddenly became stronger. And now she never stops baking every day. And they're still on Celergen and up to now enjoying their newfound energy. Even with work and retirement anxieties, I always manage to pull through with more faith, more prayers, and more Celergen, and even NGF. I began to be more focused, more positive, and I also shared it to my friends, especially those who come out of COVID-19 hospitalization, because I want them to be really well and protected. My sharing continues and extended to some doctors, nurses, and relatives. Little did I know that back in 2016, that Avita may soon become my second family after 40 years stint in the pharma industry. I learned that there is a right time for everything. It's work in progress since it's quite difficult for me to transition to where I came from, pharma to wellness. Nonetheless, I will continue to share it as I truly believe that health is wealth and prevention is better than cure. What matters to me now is to be healthy myself so I can do more for other people, for them to have a better health and better life. As the saying goes, have the rest of your life to be the best of your life. Share Celergen, share NGF, share Avita, and share and keep sharing. So thank you very much for listening. Good morning.
Thank you, Miss Rose Dumpit. I am truly honored that having shared with you Celergen has also helped you and your family. Okay. All right. I can also see Mr. Jimmy C with us right now in the gallery. I heard his story about what NGF did to him. Sir Jimmy, would you mind sharing to us your story?
Course. Good
Yes.
morning to
Yes.
everyone.
Yes.
And
Sir, yes, sir. Sir Jimmy is a businessman based in Cebu and owns the oldest museum there. He's a founder of a sports club in Cebu City. Look how he is. Yeah, very young looking, sir. Okay, sir.
okay, good morning to everyone. And regards also to Dr. Ben. And well, I am now 70 years old, as you can see. And my journey with Celergen started 2015 when I ventured into hiking the Camino de Santiago. I don't know if you guys know about Camino de Santiago, but it's an 800-kilometer walk actually from the border of France and Spain all the way to Compostela in Spain. Anyway, what we normally do is we hike 300 kilometers every year. So my first year with Celergen brought me to an amazing height. I could not believe myself. And walking 300 kilometers was not a joke for my age, and being also asthmatic and a cancer survivor. Luckily, on that year, I did not quite do very good, but because I was just starting with Celergen. However, the next year and the following 3 years of our walk or hike, I have improved tremendously, which surprised most of my colleagues who are walking with me. I could climb the Swiss Alps easily. and I walked through the coastal, uh, Atlantic coastal area of Portugal, going all the way to Spain with ease. And it really is something that I could not imagine myself doing it. Uh, and thanks to Celergen, I I am really sold to the idea of keeping myself, uh, beef up my immunity, um, taking Celergen regularly. And then came the pandemic, which was last year. I had a difficulty sleeping because of my depression. I have a history of depression, and for the past 10 years, I have been taking antidepressant pills. And so I was looking for somebody who could prescribe me more of my antidepressant pill. And as I luckily I met this friend of mine who is a psychiatrist, and she told me to stop taking antidepressant pill because it could destroy or damage my memory. And luckily, to her advice, I said, okay, so I can quit taking antidepressant pill, but I have another choice or option, which is NGF. I remember the launching of NGF few years back in Singapore, which I attended. And right now, that's what is helping me in my memory and in my sleep. I'm taking 2 capsules of NGF before bedtime every day. So all I can say is, you know, I love to share all of this to you guys because we have nothing to lose, everything to gain. And especially now that we are going through a very difficult pandemic, let's keep our immunity system strong, boost it up with Celergen and NGF. Thank you so much.
Thank you, Sir Jimmy. Yes, that's a very wonderful story. I wish I could climb with you and go with you also and walk with you. I would be happy to do that. Okay. Yes, for our last sharer, let me call on one of our platinum directors, Badette Kiblat, the trailblazing mom all the way from Cagayan de Oro City, to share to us the story of her friend whom she shared Celergen and MGF also.
Hi, thank you, Attorney Jonah, PD Jonah. Good morning, magandang umaga sa inyong lahat. I'm going to share with you the story of my good friend, one of the pioneering leaders here in Mindanao for Avita. Her name is Aiza Galilea, a registered nurse working in New Zealand. Her dream for her parents is to give them therapy, stem cell treatment. And but you know, it's very very expensive. It would cost a lifetime for her to save, and even maybe even more. And so when I shared Salergen to her, it was an answered prayer because her dream is continues to be in her heart, and with Salergen, she now has that possibility of living out that dream for her parents. And so last July 2019, her mother, Tita Lydia Galilea, living in Maramag Bukidnon, was diagnosed with suspected breast cancer because her tumor marker was going up immediately, despite the thunderstorms and the difficult road of traveling to Maramag Bukidnon. My family and I went there to present Celergen to her mother. And after 1 month, guess what? The tumor marker went down to its normal level. And Tita Lydia is able to do gardening the whole day. She's not anymore lethargic. Before Celergen, she'd sit on her bed and then fall asleep and then wake up to eat and then fall asleep again. But with Celergen, she regained her energy and vitality. And so after a month, I visited them again. And I was talking to Tita Lydia. She said, Padette, do you have something for the memory? Because I keep on forgetting things. And Aiza shared with me that dementia is in the genes of her mother's family. There were several titos and titas who has been diagnosed with Alzheimer's. And so immediately, she started on taking NGF. And again, guess what? Tita Lydia could now remember even her genes. Before, she couldn't remember anything. When she sleeps, no dreams at all. But now she's able to remember every minute detail of her dreams. And so the Galilea family is very, very thankful. And fast forward to 2021, just last May, when Mindanao was hit by a very, very strong variant of this COVID-19 virus, the family was afflicted with the virus. And Tita Lydia, because she's been taking Celergen for the past 2 years, despite having all the comorbidities, her symptoms remained mild. And so the family is forever thankful to Avita because with Avita, her parents, Aiza's parents, are continuing to enjoy quality of life. And so it is our responsibility to just share because we have experienced the benefits. The Galilea family have experienced the benefits, and they are one of the topmost leaders in Bukidnon in sharing our Avita products. So there you go, PD Jonah. Thank you for giving me the
Yes.
opportunity to share.
Thank you. Thank you very much, Badet, for that wonderful sharing. See, here in Avita, kung kayo po ay inimbitahan ng inyong kaibigan nyo, ay matuwa po kayo. Bakit? Because when we share Celergen with you, with our friends and NGF, it means we really and truly care for you. Okay? Thank you for those wonderful stories. All right, now we come to our question and answer portion. So kanina po sa chat box, nakita ko na there are already questions, and because of the stars being shared, it's being answered also. And of course, we have here we have distinguished advisors to help us out, and Dr. Ben also to answer all your questions because we only have a limited time, okay? So here, please type in the chat box all your NGF and Celergen questions, and Doc Ben, together with our esteemed advisors here present, will answer to you. But Doc Ben, here are some questions that were already forwarded to me. Can I read it, Doc?
Yes,
Okay.
please go ahead, attorney.
Ito po. What is the best age to get started with NGF and Celergen?
It's a very difficult question because we can only answer based on theoretical facts.
Okay.
Number one, degeneration or aging starts the moment we are born, so they say. But it most significantly has effects on the body's function when we stop skeletal or systemic development, which is when you reach adulthood. But the body starts breaking itself more significantly then when you reach menopause for women and andropause for men. Okay, but andropause and menopause are manifestations of the aging process already. In other words, a disease, these are symptoms na. These are already symptoms. So it would, since andropause can start as early as 35 years old in men, and menopause can start as early as 45 years old in women, it would be best to take them one or the other or both during this period. And like I said, these are just theoretical concepts that we are basing this answer on.
Okay. I hope whoever gave that question, Doc Ben has answered you, right? Okay, sir. Doc, there's another one. How will Celergen and NGF Plus help my cervical spondylosis?
Oh, okay. Well, cervical spondylosis, or spondylosis for that matter, is a general description that we apply on any disease of the spine or any symptom that we think the spine degeneration is causing. So spondylosis may include muscle spasms. It could include nerve pinching. It could include actual nerve degeneration or damage because of a slip disc. And of course, slip discs or discs are made of collagen. So number one, Celergen can help spondylosis, one, through prevention of undue collagen deterioration. Okay, number two, Celergen can help in the inflammatory process that leads to muscle spasms and even inflammation of the nerve itself if it is pinched by a disc. And as far as the nerve is concerned, once the spondylosis is far advanced, that it also has radiculopathy, wherein this is a symptom we describe as when you have shooting pains going down already on your arm or your legs, arms, of course, for the cervical spondylosis, then NGF will help regenerate the damaged nerve. I hope that answers the question.
Okay, Doc, there's another question. I have a pinched nerve on my spine and due for knee replacement surgery, but was put on hold because of a nerve problem. Would you recommend combination of Celergen and NGF Plus as a treatment?
That is a very common dilemma that we orthopedic surgeons face when a patient complains of lower extremity pain, especially chronic one at that. We have to differentiate whether it's coming from a pinched nerve at the lumbosacral level, at the lower back level, or it's really coming from the knee because of degeneration or osteoarthritis. Most often, we can differentiate through clinical symptomatology, meaning assessing the symptoms that the patient gives us or relates to us. So if it's just the knee, then the pain will not be shooting down from the lower back. Okay, so I think the dilemma of the surgeon that is handling her is that he's apprehensive that replacing the knees might not relieve the pain. But I'm sure that if the knee is really that degenerated, meaning stage 4, which is when we recommend knee replacement, then it will be greatly relieved, even if the low back pain is not addressed. So I would assess first, is the knee really that degenerated? We only recommend knee replacement for a stage 4 disease, meaning the bones are already hitting or touching each other and there is no cartilage left for Celergen to regenerate. Okay, and so I hope that answers the question.
Okay, thank you, Doc. And there's another question because, Doc, I'm also cancer
Survivor, yeah.
survivor now. Yes, I'm glad that I did not have to undergo chemotherapy or any radiation treatment. I just had surgery. And this question is that can Celergen, because I think there are some of us here who have relatives or who have cancers. So can Celergen benefit those who are undergoing chemotherapy?
There is a very viable cancer management support program, and basically this program consists of the three modalities or habits that we mentioned during the talk: diet, exercise, and supplementation. So we usually, in this program, we usually confer with the oncologist. So we don't intervene or interfere with the actual management of the cancer patient, but we support the treatment. So we also, since chemotherapy is still the gold standard for most cancers, we encourage the patient and just assure the patient that we will help you with the side effects of chemotherapy. And as we all know, most cancer patients succumb to the chemotherapy because of the side effects. Because chemotherapy kills not only the cancer cells, but also some or a lot of the normal cells around it there.
Yes, yes, I agree with you, Doc. That's why I was so afraid to to be placed on chemotherapy. And I'm really glad that I've been on Celergen in 2016, since 2016, when I learned it and when they advised my husband to take it as well.
So the simple answer to that question is yes, we recommend supplementation highly, particularly with Celergen, or if the cancer is related to the nervous system with NGF as well. But you have to clear it with your oncologist. Unfortunately and sadly for our medical profession, a lot of oncologists discourage supplementation for their cancer patients. It's not true that supplements can feed your cancers. The fact that your cancer cells are not functioning properly, that's why they're causing disease, is a reason that they will not use your supplements. Your normal cells will be using the supplements to survive the chemotherapy.
Yeah, all right. Thank you, everyone. Thank you, Dr. Ben, for all your for answering all our questions. I'm sorry for the others that we cannot entertain because our time is running out. But of course, you can always ask the person who invited you to this. And we have a lot of doctors who are embracing Celergen, NGF as well. They can freely tell you how to take the supplement and how it will affect your illnesses or health conditions. I hope your questions were satisfactorily answered by our esteemed guest speaker and advisors. And if you have further queries, please do get in touch with the person who invited you to this talk. Thank you so much, Dr. Ben. Now, let me invite you to our upcoming events. Okay, this coming August 7, 2021, my good friend Betsy Belmonte, a U.S. Air Force retiree who has had the experience of the many positive effects of Celergen and NGF and who has now turned herself to a business builder, will share to us how she can be a business builder like her. Okay. Another activity that we're going to have is on August 21. We will be conducting the Entrepreneurship Leadership Seminar, or the ELS. This will be conducted by two experienced speakers, Pearl Ambassador Joey Tan and Diamond President Thank You So. And this will be hosted by yours truly again. Join us, leap to your financial abundance. Okay. Let's have our video on, everyone. Can we please have our video on to have a souvenir photo with Dr. Ben? Please give us your best smile and put your heart emoji and give some love.
All right, ready?
Okay, are ready? Is someone taking the picture now?
1, 2, 3. There are a few pages here because of how popular Dr. Ben is.
Yes, Chong Peng,
Always.
go on.
Yeah, always the man.
Yeah.
Hey, Dr. Ben, we are not so advanced. We're using the camera that needs to be developed. So
We're not yet done, Chong Peng, because now for this special event, we will have an exciting promo. Okay. Avita Philippines is giving us a limited one-time promo of 4+1 NGF Plus for only 32,000 pesos instead of the usual 41,000 pesos from today until August 4, 2021. So for every purchase of 4 boxes of NGF Plus, you get another box for free. Isn't that amazing? So what are you waiting for? And also for Celergen, purchase 6 boxes for only 76,000 instead of 111,000 pesos. And for new members, you can have additional 2 boxes for only 23,800. Wow! Do grab this very fabulous promos. And please do coordinate with the person who invited you to this event to know more how you can avail of these products. Thanks, everyone. I sincerely hope that each one of us take a proactive role in preventing sickness in our body as well as in our family by taking Celergen and NGF and get the experience to try this amazing goodness and the results of these premium products to your health and your family, as it did mine, and to all the people here also have already tried it. Have a blessed weekend. Stay safe, stay healthy, and remember, there is no better defense than a robust immune system and having healthy cells. Goodbye, everyone. Thank you. Thank you so much.